Hey, this is Dr. C. Thank you for coming back to see me. Last time we talked about the sex education and we focused on the women. Now we're going to focus on the male side as well. We both need it, male and female. Let's face it, nobody's going to help us as seniors. We got to do our own sometimes. So let's get into the male stuff. We always start, as I say, with the basic anatomy. Well, what you see on the outside is just the penis. There's a lot more to it than that. A lot more to it. So let's start right at the beginning with the where everything comes from. Well, we also have a sac under that penis, and whatever you want to call it, that's where life begins, right? The testicle themselves. The testicles have within it some cells that will produce the sperm. It's amazing the millions, and I'm talking literally millions of sperm that are produced, well, whenever you need it, really. Millions every day. And so that is in the seminiferous tubules of the testicle and all. Okay, so that then, there's two phases to the development of those sperm. The sperm are, like I said, they begin in those seminiferous tubules, and then at a certain age, they get transferred then to the coating over the testicle called the epididymis. And then that's where they're stored. It takes roughly 70 days from the start to the finish to produce a sperm. So roughly at any one particular time, you may have 40, 50 million sperm sitting there ready to be used. Okay, so how much of the sperm is in an ejaculate? How much? What is in the ejaculate and all? That seminiferous, they call them seminiferous plasma, you might call it. So it's that milky substance that is ejected. Well, most of it does come from seminal vesicles. The seminal vesicles produce roughly about 60 to 70% of all that fluid that comes out. The thing that makes it a little thicker and milkier is the stuff that comes from the prostate gland. So 20 to 30% of the volume comes from the prostate gland. Now, you also get a little bit from the sperm itself, but that's only 2 to 5% of the total volume. That's in there. Pretty small amount, truly. Now, what else happens in the testicle besides that? Now, there's a stimulation to produce the sperm itself, and that stimulation comes from, believe it or not, follicle stimulating hormone and luteinizing hormone, and a little bit from testosterone. Now, let's talk about each one of those. The FSH, that's the follicle stimulating hormone, that gets the process started. That is, make more sperm, okay? And then the luteinizing hormone, that comes from the pituitary gland, and that tells you to mature that sperm. Get them on board. Remember, 70 days it takes to make a good sperm. Now, what else? Well, there's little round cells in the testicle as well as those tubules. Little round cells, they produce the testosterone. They're called Leydig cells, and they produce testosterone. Now, testosterone is always a big deal now, because nowadays they have some urologists who specialize in erectile dysfunction, and so they have identified low T. They may draw some blood oh, your testosterone level is below what it should be for your age. And it does go down with age. No question it goes down with age. But then they may treat you with additional testosterone. Most of the testosterone that's been given, at least when I was practicing, was by injection, intramuscular injection of testosterone, because the acid in your stomach, if you took a pill of testosterone, would neutralize the darn testosterone. It wasn't very useful. But now there are a couple of different preparations that you can take in pill form to give you some testosterone elevated a little bit. Okay, so that's the start of the sperm. Now, ejaculation takes place in two ways. Number one, produce it, put it in the epididymis, and now it's ready to go. Phase two comes from the epididymis, goes into the vas deferens, a big long tube that comes down into the urethra and out to the outside, combining the sperm with the juices from prostate and the seminiferous tubules. Okay, so we got that part. Now, that is the ejection. There's also a natural lubricant in the urethra. Now, you may have noticed that sometimes you get a clear fluid. It's a little sticky, clear fluid. That's the lubricant in the urethra. So it's produced by the bulbourethral glands that are in your urethra. So, okay. And we have, remember, the males have a long urethra compared to the female, which is a very short, only a couple centimeters in length urethra. Okay. So they produce a fair amount of clear, very clear fluid. Okay. So let's go on from there with the problems that can occur. Like I mentioned first, erectile dysfunction. That is a big deal nowadays. Many people trying to make a buck on erectile dysfunction because a lot of males do have a problem. The dysfunction may be, number one, you can't get it erect. Number two, if you get it erect, it doesn't stay erect long, so you can't really have intercourse with it. Number three, you may be, once you did get it up, you instantly eject it out. Premature ejaculation, another big problem, another big problem. So all of these are big issues. And of course, the big drug manufacturers love to get into this. Oh man, they have more darn supplements that you can use, some that you've never even heard of, from God knows where in the world that you grow these plants and all. Oh, let me give you a list of all of the stuff that's supposed to help you. Ashwagandha, oh, it's supposed to give you more energy. Oh, great. Saw palmetto, that was a supplement for the prostate and all. Ginseng, supposed to increase your testosterone. Dong Fus, increase nitric oxide. We got maca root. Oh, it's supposed to increase your intensity. Tribulus, increase the sperm production. Ginkgo biloba, increases the circulation. I can just keep going on. There's just loads of different natural, so-called natural products to improve your erectile dysfunction. Believe me, none of them work. None of them work. Don't waste your damn money on that stuff. So, what does help many people, though, and that came out, oh gosh, I forget when it first came out, Viagra. At any rate, that does work on many men, and you can get it in different strengths. And it's an easy pill to take. Half hour later, you do have some help getting an erection, keeping it long enough to have an ejaculation. Well, since they were successful with what they call vitamin V, the Viagra, Cialis came out with one, and then Stendra came out with one. And now we have 4 different ones that are on the market. But Viagra is the one that most people will relate to because that's the very first one, and it was successful for the company. It was very successful, obviously, and still is, I guess. It still is. So that was one treatment. That's one treatment. Now, if you went to a place, I'm not going to mention who they are, but the urologists who run it for erectile dysfunction and all, they claim they can get 90% of the people with ED improved. 90%. And so, wow, that's a big number. 90%. Now, there are other aspects of treatment, too, and not just taking Viagra. But you can also use things like an ultrasound to get a little better flow of blood. So that's the number 2 thing. Increase the blood flow. Increase the blood flow to the penis. Okay, so that's a good thing if they can do it. And so that's one of another treatment. And it's like using an ultrasound to increase the flow. We also have many different, historical things that were used. One was a vacuum pump. You could put the thing over your penis, use the vacuum maybe to get a more erect penis on the inside. Was minimally successful. They tried testosterone injections directly into the penis itself. They can use medications that increase the blood flow. That was by injection, so I can't imagine what the heck that felt like. I personally never had anything like that. I don't want it, but it's used. It's used, no question about it. And maybe there's some improvement as a result of it, but may or may not be. So, how can we evaluate how your ejaculate is? Well, they can do sperm counts. Now, a sperm count doesn't just count the number of sperm that are in a slide and all. There are other things that they look at besides that. Number 1, they may check it for the amount of fructose, which is the energy source for the sperm. They may look at the proteins. There's a lot of different proteins in the ejaculate. For example, the PSA. You could that's the test that's done for prostate cancer. Elevated PSA, you could be in big trouble from cancer. There's also other stuff in that ejaculate like zinc and calcium, magnesium, potassium, citric acid. Citric acid is used by the body to neutralize some of the chemicals that are in the vaginal secretions, so the sperm have a greater chance of getting to where they have to go. So that's a good thing too. You want to be able to improve that if you can. So also there seems to be also some hormones that are at a low level, but they're present in there. Levels like the prostaglandins. What that does, it stimulates uterine contraction, which helps to squeeze those little sperm up into the tubes where they can do what they have to do with the egg. So all these things are present in that seminal fluid. There's not a lot of seminal fluid, and in fact, the older we get, the less seminal fluid we will have. At first, when you were younger, you could have 5 to 7 ml of, remember, 1 teaspoon is 5 ml, so 1 to 1.5 teaspoons of ejaculate. That's a fair amount, and it may have within it up to 60 million sperm. A lot of sperm in that. So, but very few of them have the opportunity to get all the way to that egg. Only need 1 to fertilize the egg. Okay, so again, that is another concept that I like to to talk about anyway. Okay, what else can I talk about with the men? Oh my gosh, the arousal, the arousal of the men. Okay, different men and women are totally different. The women are supposed to be more emotional, the men more driven and less emotional. That's the tradition, you might say, about it. But a man can get an erection usually pretty rapidly. But women take longer. They need to have stimulation to get aroused. The skin itself is excellent. It's the biggest organ in your body, the skin. And just gently rubbing the skin, no matter where it's rubbed, does stimulate you. It's that touch. And there's no problem with delaying yourself a little bit so that the woman will be aroused and ready for you. So you need to consider that. Consider that. Slow it down. Take it slow. Then you may want to consider the not just the emotional part, but using the sensation that you can create on the sensory organs down there, mainly clitoris and the first third of the vagina where all of the nerve endings are. Use your hand. Use whatever you want. There are a lot of sex objects out there, and it's amazing. I always have the story. When I turned 60, I got to tell you this. When I turned 60, my sisters, I had three sisters then, and they got together. They said, we're going to get you well, no, they didn't tell me, but they got me one of those blow-up dolls, sex dolls. Well, who's going to buy the thing? Oh, not me, not me. Nobody wanted to buy the thing, but they wanted me to get one. Oh, what the heck? So the weakest link, I guess, was my older sister. They're all younger than me, but my older sister, she was unbelievably, I guess religious you could call it, but she had to go into this sex store and, can I buy a sex doll? Okay, sure. Here's a bunch of them. 1 holers, 2 holers, 3 holers, whatever you want. Oh, she went berserk. And so just give me that one, give me that one. Okay. So there I got my, at age 60, I got my first sex doll. At age 60. Oh, man. I never tried it out. I guess I'm probably still sitting in my basement somewhere. But I had to tell you that story anyway. It was a little embarrassing to my sister, obviously. So, okay. So let's talk a little bit more. Obviously, not as much to talk about with the, because I did talk about the sexually transmitted diseases with the women. Now, there's some that are a little more specific to the men. For example, gonorrhea. You can usually tell the gonorrhea in a male because they have it's known as the drip. So you get a greenish, creamy drip coming from the tip of the penis. Gonorrhea needs to be treated. Why? Because what it does, it inflames the urethra, and remember, after you get inflammation, you get scarring, contracture. That's what happens. You get contractures in your urethra if you're not treating that gonorrhea. And so you've got to be very careful. Check it out. Check it out. Now, there are some things that are very obvious, but you have to look. You have to use your eyes, use your senses. For example, the warts that I told you about, the HPV, the warts. You can see them. You can see the warts. Usually the males get the warts first right around the corona of the penis. That's the part that's right underneath the head of the penis. That's where the first ones occur. And with, with intercourse, they spread. They go up the penis. They can go onto the perineum. They can go onto your skin around there. And so you have to look. You have to look to see. I would not take a chance if I saw anyone with a wart. No way would I come anywhere near it. I wouldn't even touch it with my finger. You can get it on your finger. You can even get herpes on your finger. You get herpetic whitlow on your finger. So you got to be very careful for some of these things, especially those viruses. The viruses are very contagious. And so you need to be aware of that as well. Some of the other things like herpes, for example. I told the women that you can get herpes simplex 1 in the mouth and herpes simplex 2 in the vaginal area. So you get cold sores up here. They're painful ulcers. And down here, they're painful ulcers as well. So herpes. No cure for herpes, but you can use antiviral medication, which does take care of the problem now, but it can come back again later. Okay, so, okie doke. Let's then, there's a couple of other things too that are a little more specific for men as well. You can get a thing called the parasitic infections like the pubic lice. Again, you can see them if you look. You can see them if you look. Syphilis, the chancre, usually that occurs right around that corona as well. Painless ulcer, painless. If you don't treat it, stage 2 is that rash. It's a little pinpoint reddish rash all over your body. Very distinct, but that's stage 2. Stage 3, you don't want that. Brain and the aorta, the heart. Not a good thing to get. Okay, so those things, just to remind you that that can happen. There's a urethritis that's very specific for male urethra. Remember, our male urethra is much longer, and so you can get a mycoplasma in there. It is treatable. It is treatable with azithromycin. Single dose. Doesn't take much, but got to be treated. Got to be treated. How do you know you got it? You're peeing all the time because the urethra is irritated all the time. So that's a very distinct clue. I mentioned too that women, I talked about Kegel exercises because of the pelvic floor. Well, men have a pelvic floor too. Men can do Kegel exercises as well. Why do they need them? Why? Because every now and then you could dribble. Usually we just blame the prostate. But do Kegel exercises. You know, roughly about 30 to 40% of men will get improved with appropriate Kegel exercises. I got to have a little drink. My gosh. I talk too much sometimes, you know, but you can do Kegel exercises as well. You don't have to think about all of the different muscles like the women do when they do their Kegels. You just need to stop the flow of urine. So you're starting up, you're going to get that bladder neck squeezed for 3 seconds and relax. Squeeze the bladder neck again. 1, 2, 3, and then relax. You do that about 20 times, 3 times a day. You got to do it. One day isn't going to make a big difference at all. Just like when you're exercising your muscles, you're not going to get a big muscle in a day. You got to give it time, give it a month, give it 6 weeks. Then you'll start to see an improvement. Hopefully see an improvement. Now, there was a big thing back when vasectomies came in. That was, again, while I was still practicing and all. And the vasectomies. all sorts of literature came out. No proof whatsoever that the vasectomy causes long-term effects. But they didn't know, made it an article. It could do this. It may do this. None of it proved successful. Vasectomy doesn't affect your sexuality at all. At all. Okay? So it doesn't, when you get your vasectomy, you take a piece of that vas deferens out, a little piece. You sterilize the ends so they scar over. And then that's it. Under local anesthesia, simple procedure. Simple. Okay. Can it be reversed? Yes. Yes, it can. And what they have to do is they put a little tiny tube within the urethra itself. I'm sorry, in the vas. They do it from below. Get across that area. That's now they cut the ends open. Now you got two open ends. Tube comes through all the way through to the other end. And then some real small sutures to hold the outside part of that vas deferens together. They leave it in for a period of time, and then when they pull it out, hopefully you can now get sperm through. And yes, you still can produce sperm. Certainly, the volume of the fluid goes down considerably as we get older. The number of sperm, the count itself, will go down naturally anyway, but sperm can come through despite the fact that you have had a vasectomy. So none of that seems to be an issue. None of it. Okay. People now are, the urologists especially, are treating people either with testosterone or human growth hormone. Growth hormone stimulates testosterone as well, and is used in treatment. So I don't know if I wanted to fool around with using a lot of these hormones and all, because every time you use a hormone, your body doesn't have to produce it, so it cuts down. Well, I don't need it because I'm getting it. So you got to consider that as well. But those are things that are out there on the market, and you have to deal with it at times. You do. Okay, I think I've dealt with things pretty much all that I wanted to do, talking about sex education for men and women. I hope that you have an enjoyable day, and please remember, use protection. This is Dr. C. Have a good day.